So let's talk about HIV. So lots of things have changed massively regarding HIV. It is no longer considered a gay disease. It's no longer a death sentence. No one born after 2005 has seen anyone die of HIV or AIDS. That's because the medications that we use for HIV are so effective. They're really great. Once you're infected with HIV, there might be some acute symptoms initially after getting infected within 2 weeks, and that's really like flu-like symptoms. And then you might not have any symptoms for the next 10 years. That's why it's really important to get tested to know your status and not wait until you see symptoms. If you are HIV positive, then we can treat to prevent you from getting AIDS. There are also a whole host of things that we can do to prevent you from getting HIV in the first place. One is knowing your partner's status, as well as using condoms on a regular basis, as well as two different ways of using medications called post-exposure prophylaxis and pre-exposure prophylaxis. So post-exposure prophylaxis is when you take pills after having unprotected sex within 72 hours for a month, and that will prevent you from getting HIV for a risky event. Pre-exposure prophylaxis is taking medications ahead of time to prevent you from getting HIV in any future events. So there are a number of ways to take pre-exposure prophylaxis. If you're not having sex very often, you can do PrEP on demand, which is taking pills before and immediately after having unprotected sex. There's also pills that you can take every day as long as you need them to prevent you from getting HIV. And there are also two types of injections, one that you get every 2 months and one that you get every 6 months that also can prevent you from getting HIV really extraordinarily well. Now, the key point is we shouldn't have any new HIV infections in 2025. We have great ways of preventing anyone from getting HIV. It's important that you know about that, and it's important that your doctor know about that so that you can get the prevention that you need if you're at risk.